I'm going to cover U.S. healthcare delivery using a mind map I created, and I'm going to attempt to do this in 2 minutes, but if I get it under five, that's great. I'll try to use my uh, mouse so you can follow along. Before we talk about the U.S. healthcare delivery system, I'd like to talk about healthcare delivery systems in general. Now, they range from completely public or nationalized systems to completely privatized systems. They fall along that spectrum. The most nationalized is something like the beverage system in UK, down to the Bismarck model in Germany, which is delivered where healthcare is delivered privately and paid for privately. From national to public, you tend to pick up more payers and you tend to gain in costs, not only on a out-of-pocket basis, but a per capita basis too. It's more expensive for the government and country, and it's more expensive for the patient. Now, I will say there is just many countries that don't have a system where the exchange would be between the provider and the patient and likely not be affordable or great. But now that we have an overview of systems, we can start to look at the US healthcare system. For one, it's not really a system. It loses the kind of uniformity and systematic approach of the ones we've discussed already. You lose in accessibility. All of these systems are intended to be universal, to provide universal coverage, whereas the US healthcare system does not. However, our system is very, very profitable, uh, where all of these systems are not for profit. So if we look at the US healthcare delivery system, you'll see that it actually has many components of other systems. For example, the Veterans Health Administration is completely nationalized, whereas Medicare and Medicaid is paid for publicly, but is delivered privately. But the majority of Americans have employer-based insurance like the Bismarck system, where they pay for it privately and it's delivered privately. But when there's no universal coverage, we have another group of people who are just uninsured, which in the case of an emergency could accrue large medical debt um, and perhaps even go bankrupt. Now, how did we get here? Well, since colonial times through modernity, we've just increased in complexity in a number of dimensions. I've got a few listed here. For one, medical education has gone from a trade for physicians, where they were taught with apprenticeships, to now many years in medical school and internships and fellowships. The intimacy has changed quite a bit from a healthcare delivery that could be done by families and neighbors or physicians in the home to something as remote and impersonal as telehealth. Treatment has changed significantly. I just noticed I misspelled that. Uh, from folk remedies and a non-scientific way to treat to the advanced therapies we have today, from specialized surgery to um, advanced medications, vaccinations. Technology has changed significantly. Early medical advancements would have been something just like washing hands and x-rays. And now we have advanced medical imaging equipment, the use of AI. We know about genetics and can harness the power to inform treatment. The setting has changed significantly from, you know, facilities that were just based on social welfare for indigent and maybe elderly folks, and maybe even used for isolation to medical centers and um, specialized surgery centers, medical campuses, large health systems, so increased in size and complexity. And of course, the payment system may be the uh, most significantly changed of all. We went from a system of direct payment, maybe even bartering a little bit with your care provider, to a system where, by and large, patients don't even really see an exchange of money between their providers. There's many parties. So here are my references. I think with healthcare, you can only cover so much in this short amount of time. But hopefully, I did the topic justice.